Welcome back to and thanks so much for joining me. In the last episode, I discussed the solve step of the population health cycle. In this episode, we'll discuss the score step. So you've now been operating your program, and how do you know if it's done any good? Well, you have to score it. In the score step, you analyze the data that you have been gathering on your program. So what do you need to score to determine if your program worked? Obviously, one of the first indicators is getting your population involved from the cell step. A basic score is what percentage of your target population is enrolled and actively participating in your program. Far too often, as I've mentioned, we see the typical 20 to 40% enrollment rate, which is just too low to move an overall population's health. The percentage of individuals enrolled is an early indicator of your program's potential success. It should be reported monthly, and you should be tracking this on a daily and weekly basis early in your program's operations, so this will be one of your scores. A not so funny side story on participation rates? I was reviewing the program of one vendor and asked them how do they determine participation rates. The first few comments were typical. The member called in and spoke with the team. We called them during the period and got an update, etc. Then they dropped the bomb. We also count them as participating if the mailer we sent to their address is not returned. You're kidding me. Obviously, their numbers were bogus. Another operational area to score is the contacts your team makes, such as home visits, calls, mailers, texts, and efforts which don't result in contact, such as call not home, call number disconnected, mailer return for wrong address, and on and on. Care plans and action items within the care plans completed should be scored. You'll also want to understand what sort of activities your team completed, such as scheduled an appointment, assessment conducted, referrals made and to whom, spoke with the physician, arranged transportation, or worked to solve other social determinants of health issues. These are examples of process measures, and many of them are leading indicators which can be gathered early in a program and show results. More importantly, one needs to score outcome measures as we discussed earlier. Some of these measures take time to see results, and as such, they are lagging indicators. For example, if one is looking to improve A1C values in persons living with diabetes, that takes some time, or ER visits, hospitalization rates, adherence to prescriptions. So obviously, you may have initial results, and perhaps 6 months later, you have another result, and then again, another result. Understanding when various outcome measures are likely to indicate a change and measuring it at that time is critical. Other outcome measures could include costs, quality of life, satisfaction with your program. There are literally thousands of potential measures, but remember, if you don't gather the data from the survey step and ongoing, you can't score it. Typical programs score their results monthly, perhaps provide a quarterly report, and then an annual report. Each of these should lead to an understanding of the impact of your program for you and your clients. These are some simple examples regarding the score step. It is much more complicated and should include validated statistics and even study design to demonstrate your performance. If you'd like more information about this score step, what to score, how to build out these reports, and how to ensure they are valid, contact us at info@accountablehealthllc.com. Thanks for watching, and please look out for our next episode on Stop, Start, Same of the Population Health Cycle.